thank you guys for all coming today. So, of course, PJ, Daniel, and I are all junior doctors, all dedicated to pursuing a career in psychiatry. And we are fortunate enough to have Lade with us today, who is candidate for RCPsych Presidency. And as junior doctors, it's wonderful for us to have this space where we can speak to someone who is likely to be in charge of really important decisions that will affect not only the next few years, but well into the future as we are at the beginning of ours. So I personally am not an expert in a lot of the junior doctor issues, to be honest with you. I say that putting myself relative to PJ and Daniel, who I think are much more well versed in what kind of issues we face with all of the stats and facts behind them. So I'm hoping we can have a really productive conversation, and I'll start by introducing myself, then we can go around. So my name is Manu Sidhu. I'm a F1 doctor, so I've just started. I'm a Psych Foundation fellow, so I'm happy to already be well within 1 foot in the door, really, with regards to being in the world of psychiatry. And it's these conversations that really keep the juniors engaged and listened to. So I'm currently working in the Cambridgeshire and Peterborough NHS Foundation Trust, and I'm soon to be moving on to my next rotations. But that's me. I'll move on to Daniel now. If you could introduce yourself.
Hi, hopefully you can hear me. My name is Daniel Zahedi. I am also an F1 in Adam Brooks Hospital in Cambridge, and I'm the co-chair of the East of England BMA Junior Doctors Committee. So it's lovely to meet you all. Have a strong interest in psychiatry and a bigger interest in fighting for full pay restoration for our junior members. Thanks.
Okay, good to meet you.
And PJ?
Hi there, my name's PJ Wang. I am a CT1 psychiatry trainee in Northwest London, and I'm also elected as a BMA council, a junior doctors branch of practice a representative. And I do organise with Doctors Vote, and I also have a very keen interest in terms of our pay and our conditions and striving for the best that we can do for junior doctors. So I'm very interested to speak with you, Lade, about your position on juniors issues and how you might be able to assist us in any potential role that you might have.
Sure. Okay, so thank you so much for inviting me to speak with you, and thank you for taking the time. I'm very pleased, Manu, that you're doing Psych Foundation. I really, really hope that you come into psychiatry, and brilliant, PJ, that you are in psychiatry, and I'm really hoping that things improve so that you'll want to stay. And Daniel, you definitely want to do psychiatry. It's a great job. It really is. Never gets boring. Never gets boring. So, okay.
Brilliant. And I know that we all know you very well, Lade, but do you want to give just a quick intro for yourself as well?
So my name is Lade Smith. I'm a consultant psychiatrist. I'm the clinical director of my service at the South London and Maudsley NHS Foundation Trust. I also happen to be clinical and strategic director of the National Collaborating Centre for Mental Health at the Royal College of Psychiatrists, where I am also presidential lead for race and equality. I suppose I ought to also say that I am one of the presidential candidates for the Royal College of Psychiatrists presidential election. So hopefully, if the new president will be elected in the next few weeks.
Brilliant. So, okay, I think a great place to start would be to open the floor. Lade, do you want to pose a question to us, perhaps?
So actually, it's interesting that Daniel and PJ in particular have mentioned about, you've already mentioned some concerns about junior doctors' pay and work conditions. And one of my presidential priorities actually is supporting psychiatrists so that we can do our jobs properly. And I'm really concerned that that morale's really low. And it's low in a way that I mean, I've been doing my job now for 30 years. I started doing psychiatry in 1992, and there are times where it waxes and wanes. There are times when morale's been low and then it gets better, morale's low, gets better. I've not seen it like this for a long time. And people talk about not quite having the basics, having difficulty getting their, just basic equipment, office space. We know that senior doctors like myself I'm retirement age and there's a big pension tax problem. And of course, for junior doctors, there is the whole pay restoration. And I'd really like to know what your thoughts are and what you would like, actually. How would you like me? I'm a medical manager. What support would you like from me?
So that is certainly something that we'd be very interested in, and it's a very good omen that you have an awareness of the issues in terms of pay restoration, in terms of our working conditions. One of our major concerns in terms of junior doctors, in terms of the BMA, in terms of the profession, is in terms of the most immediate issues. Obviously, I'm sure there is a junior doctors ballot for industrial action happening on January the 9th. And we're looking to get support from as many junior doctors as possible. We have a significant amount of support from our consultants, but what we are interested in is what potential support that you could offer to us as junior doctors in terms of our fight and our industrial action or our campaign for pay restoration if and when we do pass this ballot and we are undertaking any sort of industrial action.
Okay, so I mean, the first thing to say is that I know that junior doctors, just like myself, don't want to have to take industrial action, actually. And it's the very last resort. It's the last thing that people think about, because people are really concerned about ensuring that patients are safe, that quality of care is not compromised in any way at all. But the very fact that junior doctors have got to the position where they're even thinking of balloting for industrial action tells us that there is a major problem that has got to the stage now where it's insurmountable, I think. And I say that because I've spoken with junior doctors where I work, and what they say is we feel actually a bit embarrassed about having to ask for money. But the truth is that we're having to take on extra work to make ends meet. These are doctors having to, and of course, if you're somewhere like London, I work in London, then just being able to afford basic things, being able to afford rent somewhere that's, a decent place to live, that's comfortable because you're working hard, you want to come back to somewhere comfortable, that's not so far away from work that you have to have a kind of hour and a half commute to get in. That's fair enough. And then also you've got junior doctors who are getting a little bit older, who are starting families, they want to be able to buy a house, etc. And there's no way they can do it on their salaries because their salaries haven't changed, haven't changed incrementally for years. They haven't risen in line with inflation. And so I'll give an example. When I was a junior doctor, say I was a registrar in 1995, and that's when I bought my first flat in London, in Clapham. And it cost, you're going to feel a bit sick now, but it cost £82,500, right? Which at the time, I didn't eat. I had to eat pasta for a week, for a month or something, just pasta and oil, because it was at the time it was an enormous amounts of money. But the reality now is that one of my junior doctors at the same stage, I say to them, where do you live? And they'll say, I live in Orpington. I'm like, why are you living in Orpington? Because that's what they can afford. And then this is all very well, but I mean, I lived, maybe 20 minutes from work. They're living an hour plus from work. And so back to your questions, I digress. But I number one, I recognise that junior doctors wouldn't even be contemplating this unless there was no other choice. I really wish it didn't have to happen, and I hope it doesn't have to happen. But that's about the government recognising the dire straits, how dire things are. Our junior doctors are some of the most highly trained doctors in the world. And I know it doesn't always feel like that because we get a lot of negativity sometimes, but our doctors are some of the most highly trained in the world. And so that means that our doctors are really, really sought after across the world. And junior doctors recognise that. They think, right, I'm going to get my training and then I'm going to leave so I can have a comfortable life. And I'm sure you will know people who will say, I'm just going to go to Australia for a year, and then they don't come back. And we can't have that, because it's not like we're losing people from the NHS simply. We're losing doctors, full stop, from the country, because medicine's a portable, it's a portable profession, and we've got clever kids who can, if need be, can do other exams. They can do Canadian exams and can do, if need be, American exams. So there are other places that people can go to. And in fact, a lot of places are qualifications. You don't need to do the exams anyway. What would I do? Well, first and foremost, I would like to work with our junior doctor to say, all right, what kind, different types of industrial action that people might take. I'd certainly want to be, we'd sit down together, be in dialogue, and work out what we can do to ensure that the service remains safe. And that will, range from, basically it's acting, it's called acting down. So I as the manager will cover the junior doctor's work if I have to. If I have to take the bleep, then I'll take the bleep. That's how it, that's how, as far as I can see, that's what we'll have to do. I mean, there were, I'm hoping we wouldn't. What I'd like to see, if it's going to be industrial action, I'd like it so that it wasn't a prolonged thing, a prolonged kind of thing, so that we could manage that cover, because you can only manage that cover for so long before the system breaks, and then it does become risky. And so, but certainly I would be working with the junior doctors so that we can cover basic duties and kind of emergency duties, so to make sure, and just to ensure the service is safe, basically. Yeah.
Certainly, it is heartening to know that you are aware of the plight of junior doctors in the country, and how we have been pushed to the point where we are exhausted, we're burnt out, we're at the end of one's tether with the conditions and the pay cuts and the working environment that we face. And it is very valuable to have your perspective and support on that. Something that we are curious about is the specifics about progression and training, and how that might be, how there might be some arrangement that we could make for certain junior doctors during industrial action. As you might know, Health Education England, they have taken a position, as well as some Royal Colleges have taken a bit of a stance, being less than supportive of junior doctors in their quest for pay restoration. And we'd very much want to have you as president and the Royal College of Psychiatry on side, united with junior doctors and with the union on this. So we're just wondering,
I think one of the things that we ought to be doing now is really talking to government, actually, and trying to avert this. Because, as I say, I remember the last time there was junior doctors action, that undermined the kind of, if you like, the social contract that existed. It undermined that trust, and it was really unfortunate, because I think that broke something that has yet to be repaired. I don't like the idea of junior doctors and senior doctors being at odds with each other. That's not good at all, actually. And I think senior doctors should stand together with junior doctors, and what we should be doing is supporting junior doctors to petition government to take the plight of junior doctors, more well, actually, at the very, to take it more, I'm not sure, I can't say the word seriously, I think they're taking it seriously, but to consider a different approach to how they're dealing with the junior doctors. I think it was really unfair that junior doctors, for example, everyone else in the NHS was given a 4% pay rise. We know it's below inflation, not great, but nonetheless, we're given a 4% pay rise. But to say to junior doctors, you can have the 2% that you, you know, that you got from last time. I think that was unfair. Just that in and of itself was, it felt a little bit like a slap in the face. And really, they should at the very least have said, and junior doctors will get the same wage, you know, the same pay rise as everyone else does, even if that's still a below inflation pay rise. And I think there are things that could be done that could help bring the two, if you like, the two sides together. I don't think it's useful that junior doctors and senior doctors will be at odds at all.
Okay, so certainly we'd be looking to get.
I completely agree with that.
A lot
because
of colleagues in senior registry.
is that some echo? Can you hear on my side? Anyway, sorry, I thought I could hear an echo when I was speaking, but let me continue where I was before. I completely agree with that approach of the seniors and juniors coming together. It's something that I haven't heard of yet, because it's a shame how a lot of the juniors feel like they're battling their own in this battle, fighting against their own, and that makes us feel even more disillusioned with our careers, and that is driving people abroad, as you said, Lade. And I think it would be a good thought experiment just to ask you, Lade, how do you think the seniors coming on board with the juniors could change the strategy that the juniors have? Because at the moment, the juniors are kind of left to their own devices and thinking of striking, and that's just going to harm services, really, isn't it? And that's going to harm patients, and that's not, none of us want that. It seems like the people who really need to feel the ferocity of this campaign are the government, and when we strike, it seems like they don't even feel that in the slightest. And so that's why I think a lot of the juniors feel like quite powerless, really, because even if we do strike, the people who really need to hear us probably don't even care that we're not at work that day, because even as you said, they think the seniors will just pick it up. So how do you think the seniors can help the juniors really approach the decision makers here? Because at the moment, I think the juniors are struggling to do that on their own.
Well, I think the ideal thing would be, I mean, dialogue is always important. And the ideal thing would be that the senior doctors, who usually have much more access to government and to the decision makers, actually petition on behalf of the junior doctors and help the decision makers to understand how dire things are for junior doctors. Because I think there is an assumption that, well, you're a doctor, so you're earning enough. And that's just not the case. It's all relative, isn't it? And you know, and if I've seen stuff on Twitter when it was first muted that the junior doctors might take industrial action, and there was a Twitter thread, and someone said, well, you know, if you wanted more money, maybe you shouldn't have been a doctor. And I was thinking that's really unhelpful, because actually these clever kids could have been anything they wanted to be. And they could have been engineers. They could have gone and worked in the city and earned, you know, be bankers and earn huge amounts of money. Could have gone and be lawyers in the city and earn lots and lots of money. And actually, what they've chosen to do is to work as doctors, assuming that they would be given a decent enough wage to be able to make ends meet and not have to take an extra job. The other thing is that, again, when I was a junior doctor, we used to do the stupid hours, you know, 100 hours plus per week. And the working time directive was brought in because doctors were falling asleep over operating tables and crashing their cars and, you know, getting horribly maimed or killed, you know, making mistakes because they were so tired. And it doesn't make sense to be paying people in such a way that they feel that, and it's a really highly skilled, really important job, but you have to have your wits about you. You do your 48 hours, whatever it is, and then you think, right, I'm going to have to go and do an extra job at the weekend. That defeats the purpose. And to be perfectly honest with you, I'm pretty sure that junior doctors are not greedy, in my experience. Junior doctors would settle for something that allowed them to have a you know, sensible way of life. They're not asking for anything extravagant, but with the cost of living crisis, the rise in inflation, junior doctors cannot make ends meet. And what we need is for junior doctors to feel comfortable enough so that they're not making, they're not having to do extra jobs, so that they're not really, frankly, worrying about debt. I mean, you've already got really big debts as well, haven't you? Again, I think, I'm a senior doctor about to retire, and I didn't have to pay to go to university. In fact, I got a grant. And I lived in London, I trained in London, and and because I was in London, I left with debts. It was hard enough as it was. I can't imagine leaving with a £100,000 debt and then not actually earning enough money to be able to manage that debt. And what will happen is that junior doctors will gradually be thinking much more about the money and much less about, the job. And it will mean that people will leave. They won't necessarily go into private work. They'll leave the country because they don't feel any allegiance or any kind of loyalty to, certainly not to the NHS and certainly not to healthcare in the UK.
Yeah, certainly that's a notion which is very much bandied about, that junior doctors today are suffering in terms of junior doctors on average leaving medical school with about 80 to 100,000 pounds of student debt. Junior doctors having a pay cut of 30% compared to 15 years ago, because doctors as a whole have not had a single above inflation pay rise since austerity began, since 2008. And it's resulted in a 30% pay cut to our pay packets, and junior doctors leaving on average of £14 an hour as an F1, and it's creeping to the point in terms of trends where it's going to be below the London living wage in several years. So to the extent where our doctors are very much struggling with their extra exam fees, with their GMC fees, with a huge array of extra costs, and having to be sent around the country on numerous short rotations, and never having the ability to settle down, and having such disruption to their home life. A lot of junior doctors are having huge concerns, and these grievances are coming to the fore. And first and foremost, it's survival. The reason pay is first and foremost is because junior doctors are trying to survive, and it's very difficult for them to do so. It is very much a much more difficult time in terms of junior doctor surviving than it was for previous generations, and I'm very thankful that you're aware of that. And I think just one last mention about this topic of industrial action and pay before we get to certain other topics. But as someone who's very aware of these issues, if you were elected as president of the Royal College of Psychiatrists over these next 3 years, it's a formative time, especially in the new years with industrial action coming to the fore. Could we get a guarantee that the Royal College of Psychiatry would not undermine a junior doctor industrial action? That's all we ask for. We ask for your support, or at least not to undermine our industrial action. Would that be something that
we would? I mean, is it, as far as I'm concerned, me personally, I support junior doctors. Okay, for sure. And I'm pretty sure that the majority of psychiatrists support the reasons why junior doctors have found themselves in this position. Actually, and we will do whatever we can, number one, to ensure patient safety, and we know that our juniors really care about patient safety and quality of care, and will do whatever they can to ensure that happens, even if industrial action has to take place.